In tonight's news, dementia is a growing public health concern in Canada and abroad. According to the World Health Organization, 47.5 million people worldwide live with dementia. In Canada, more than 402,000 seniors 65 and older are living with dementia each day. It is predicted that by 2031, the total number of healthcare cost to Canadian will be $16.6 billion, and it was only $8.3 billion 2 decades earlier. It is estimated that men with dementia lose about 16 years of their life, and women lose about 15.2. Currently, there is no cure for Alzheimer's. Over to you, Stephanie.
Standing in front of this long-term care facility where individuals with dementia currently reside, I had the opportunity to talk to Dr. Smith to find out more information regarding secondary prevention strategies for dementia. Secondary prevention involves screening tests for dementia. One of the tests used is called the Abbreviated Mental Test Score, which involves the patient answering questions regarding their age, time of day, recalling their address and world events, the current year, their date of birth, and counting backwards from 20 to 1. Another more widely used test is referred to the Mini Mental State Examination. This test assesses the severity and changes within the brain over time and evaluates the patient's language construction, orientation to place and time, attention span, and the ability to recall words. There is no one singular test for dementia. If you or your loved ones are concerned about dementia, Dr. Smith suggests visiting your primary healthcare provider to discuss the next steps in your dementia journey.
We're talking about dementia with Helen Morton. Helen, how has dementia impacted you?
My husband Roy was diagnosed with dementia, Alzheimer's, and because I was his wife, I became his caregiver.
So once he was diagnosed, what was offered to you in order to help improve his quality of life?
We were offered medication, we were offered caregivers, we were offered Alzheimer's with the Alzheimer's Institution to understand what it was all about, and a menu that would help us out.
Were you offered any education around healthy eating?
We were told he shouldn't have bread, he shouldn't have wheat at all, and that meant a lot to his diet, and we tried it for a while, and he refused.
So what were some of your barriers then in order to, use these resources?
He refused to take it.
He was used to
his diet for 70 some odd years, and he just wouldn't change.
Fair enough. So what were some of the things that really brought him to light? What were some of the, what did you guys
do? Going out and socializing and with relatives and friends and playing cards and whatnot. Yeah.
Thank you very much for talking with me today. And it's nice to hear about Roy. When we think about prevention methods for dementia and Alzheimer's, it's important to consider diet and lifestyle. It is predicted that the number of individuals with dementia globally will be 152.6 million people by the year 2050. Age is the highest risk factor for dementia, and slowing cellular bioenergetics and metabolic processes is associated with aging. Therefore, a nutrient-rich diet is important for maintaining optimal brain health. Type 2 diabetes is a risk factor for Alzheimer's. People with type 2 diabetes are 60% more likely to get dementia than those who have type 3 diabetes. So a diet that reduces the risk of type 2 diabetes will also help reduce the risk of dementia. Diets such as the Mediterranean diet, MIND, and DASH diets may also prevent or slow cognitive decline. These diets include fruits, leafy greens, vegetables, fish, nuts, and olive oil. Other dietary approaches like ketogenic and intermittent fasting have also shown to be beneficial for the brain and brain health.